Welcome to my presentation on treating trans clients with OCD. This presentation is going to give you the tools to support your trans or gender questioning clients using an ERP framework. We're going to first talk about general skills that will help with your trans competence, like creating a therapeutic environment where trans clients can feel comfortable. And we're also going to learn some specific skills for treating gender-related obsessions and compulsions in trans clients. So let me introduce this presentation by talking a little bit about myself and the topics I'm going to cover today. My name is Andrew Triska. I'm a therapist in private practice in New York and via telehealth in the states of New York and New Jersey. I specialize in treating anxiety, OCD, and hoarding in trans and queer clients. I've also just been appointed to the U.S. PATH Educational Committee, which is a committee within the U.S. branch of the larger World Professional Association for Transgender Health, or WPATH. I've written several books on queer and trans mental health for both professionals and the general public, including a project I'm very excited about called the Gender Deck, which is a card deck designed for mental health professionals and educators to open up conversations about gender identity with their clients. My other books include Sexuality and Intellectual Disabilities, Gender Identity Workbook for Teens, the Transgender Self-Care Journal, and Parenting Your Transgender Teen. So just a little bit about what we're going to cover today. We're going to be talking about general treatment considerations in treating trans clients with OCD. We're also going to be talking about how to treat trans clients who have specific gender-related obsessions and compulsions, which is very common, almost ubiquitous in my experience in trans people with OCD. So that's going to be our main focus today. Now, just to note, this presentation assumes that you understand the fundamentals of trans-competent psychotherapy and you can interact respectfully with trans clients in a basic way. We will talk briefly about the basics of treating trans clients, but we're really not going to go over a lot of like Gender 101 type stuff or gender-related vocabulary. There's a lot of material out there to help you learn that stuff. WPATH has a lot of resources on their website if you're interested. This presentation also assumes that you understand that providing gender-affirming care to trans clients is the standard in healthcare today. There's really no debate about that at this point. In general, if someone wants to affirm their gender with social or legal or medical steps and they have good judgment and aren't experiencing any symptoms that would prevent them from making informed decisions, there's really no justification for preventing that. For those of you who want to deepen their knowledge, I always recommend just watching queer media, reading books about trans and queer people, and above all, listening to the experiences that trans people have had while accessing healthcare. In other words, there's nothing that's going to build both knowledge and basic empathy faster than just absorbing first-person stories by trans people rather than just about trans people. So the first thing we'll briefly talk about is how to use affirming language in treatment. We're not going to spend too much time on this because we have plenty of other stuff to get to, but I just wanted to make sure that we all have some solid grounding in how to talk about gender with our trans clients. The thing I always tell therapists first is that the most important thing your client will take from your initial sessions is how you made them feel. I've had plenty of trans and queer clients say that they've had great experiences with a healthcare provider, not because that provider knew a lot about gender or sexuality, but because that person was open to learning about them and asked them questions about their experiences and what might be helpful to them without making assumptions. In other words, you want to be curious about what they need from you and validate and affirm what they've already told you about themselves. To that end, you'll also want to make sure that you're using the words the client uses for themselves, which will further help them to understand that you do take their needs and wishes seriously. This means that you don't need to know every bit of the vocabulary up front. Although it's definitely helpful to have terminology in your pocket, it's impossible to know everything, even if you're trans yourself. What you need to do is to demonstrate willingness to learn the words that your clients are using to describe themselves. Another thing to keep in mind in treatment is whether you're using language that others the client. In other words, makes them feel as though you're seeing them as something separate or alien from yourself, like you're normal and they're not. So in order not to come across like you see cisgender people as the default and transgender people as the exception, you're going to want to use the word cis as much as you use the word trans. So, for example, if you're talking about cis women, you need to be willing to say cis women and not just women. In other words, don't just use that extra descriptor only when you're talking about trans people. You don't want to be in a position where you're saying women and trans women or men and trans men, like trans people are in some special category, because that can be very alienating to trans clients. And definitely don't use terms like normal or regular when you're talking about cis people. Similarly, don't treat a trans person's gender like it's a preference or an identity they've just decided to adopt one day, while you're treating cis people's gender like it's real or natural. To that end, it's best to just say your gender rather than your gender identity or your identified gender, in the same way that you talk to a cisgender person. Similarly, just say pronouns instead of preferred pronouns, because everybody has pronouns, and trans people's aren't any more preferred or less real or valid than anybody else's. So, like I said, we're not going to go into detail about specific gender-related vocabulary because you can learn that anywhere, and there are a lot of online resources to help you learn that. But instead, I just want to give you some kind of direction for what kinds of words you're going to need to know in order to treat trans clients. So you can go out and learn those words if you feel like you need more of a vocabulary than you have right now. You're going to want to learn the definitions of the basic terms for different identities like binary or non-binary, gender fluid, gender queer, and how these labels might overlap or contrast with other identities. You want to know about the difference between gender identity, gender expression, gender roles, and of course the difference between gender identity and sexual orientation. You'll also need to know how to talk about what gender was assigned at birth if you need to do that. So you need to be familiar with terms like AMAB, which is assigned male at birth, AFAB, assigned female at birth. You'll also need to know terms that you can use to respectfully describe bodies in a gender-inclusive way, even if you don't yet know what terms the client themselves uses to the client uses to describe their body. You can also learn to use gender-neutral pronouns like they, them, or other gender-neutral pronouns like ze or here, and to use gender-neutral language like parent or sibling for non-binary clients or other people who use those terms. It's also a good idea to learn the appropriate times to use or to not use gender-neutral language and pronouns, because many trans people do use gendered language and pronouns like he or she, and you should really only use the language someone requests you to use and not just assume. Lastly, you'll also want to learn to avoid outdated or incorrect language. You can pretty much Google gender-inclusive language in healthcare, and you'll come up with all the resources you need for this. So we're first going to talk about general treatment recommendations for treating trans clients. And to start us off, I just want to talk about some of the common experiences that trans people have when they're trying to access mental or physical health care. This is important to know because your client is going to be coming into your office with a lot of these experiences, and part of your work is going to be undoing some of that damage and showing the client with your actions that you're not going to mistreat them. One thing a lot of trans clients experience is going to a therapist or other healthcare provider who calls themselves trans competent or uses words like LGBTQ affirming on their website, and turns out actually not to be that knowledgeable at all or to have that kind of specialized experience. And this is one area where you really have to be really honest with yourself and ask yourself, am I a specialist in trans mental health care, or do I just know the bare minimum? And if you don't feel like you have the right level of knowledge, I'd really reconsider tagging yourself with that specialty on like Psychology Today or other directories, and really be careful that the language you use on your website doesn't imply that you're a specialist. Another common problem is a lot of trans therapy clients need to educate their providers about the basics of gender, which they should really not have to do. It's totally okay to ask a client to explain something about themselves or define what they mean by a given term, but if it's more of like a general gender 101 thing, you're better off Googling it or getting some kind of continuing education. You're also going to want to avoid questions that are meant to satisfy just your own curiosity and aren't actually relevant to treatment. Now, some therapists actually go in the opposite direction, and they get so skittish about saying the wrong thing and actually don't ask relevant questions. And this is where getting some continuing education about gender identity comes in handy, because when you know the difference between a clinically relevant question and an inappropriate or intrusive question, you can be confident and you don't worry that you're going to upset someone. One other thing, and this is purely a logistical thing, but you want to make sure that your EMR, your paperwork, all of that is set up to be gender inclusive and that your receptionist, your billing staff, and all that are respectful. All of the major software companies, Epic, Simple Practice, Therapy Notes, they can all accommodate names and pronouns and gender markers that are different from the ones on the client's insurance, and you should really make sure to get that set up correctly before you think you need to, because eventually you are going to have a trans client. Lastly, you're going to want to avoid pathologizing the client's identity. I have had so many clients report that previous therapists have considered their gender identity to be a symptom of a psychiatric disorder, or the result of trauma, or that their therapists have questioned or doubted that they're actually trans without actually taking the time to understand them. So really, you just need to be prepared to validate what the client is saying about their gender in the moment and not automatically attribute it to some external cause. Now, one of the most common goals that you're going to have with trans clients with OCD is to help them enhance their level of social support and stability. I mean, yes, this is true of most clients with OCD. For most people, symptoms are exacerbated when they don't have a high level of social support. But it's particularly true with trans clients because it's so common for trans people to come into therapy with experiences like social rejection, family rejection, or unstable housing or employment. It's really, really hard to treat OCD symptoms when your environment or your circumstances are just causing you high levels of distress. So you're going to want to make sure you get the full picture of a client's life, their housing, their relationships, their family, chosen family, social support, whether they're experiencing abuse or mistreatment, whether they have other trans people they can talk to about their experiences, trans role models in their life, all of that stuff that can either be a source of distress or a source of comfort. And you're going to want to make sure that all this stuff is appropriately prioritized so you're not just treating symptoms. And this is also a good time, by the way, to make sure that you have resources on hand in case the client needs a referral, let's say to a housing caseworker or a healthcare primary care doctor, anything they might need. As I said, ERP is going to work so much better when somebody is in a stable place in their life and has people around them providing the kind of support they need. Because so many core fears in OCD relate to losing relationships, being rejected, or being alone in some way. Now, one minor caveat is that you should make sure that you're evaluating all sources of stress and not focusing just solely on stuff like gender dysphoria or discrimination. It's true that their greatest source of distress might actually be gender stuff, but it could also be the Mets. You're also going to need to normalize uncertainty and ambivalence around gender. So a little bit of background on this. 50 years ago, if a trans person went to a gender clinic, they would be automatically rejected if they expressed even the slightest ambivalence about their gender. But now we recognize that uncertainty is a totally normal part of gender exploration. We recognize that a lot of people, even trans people with no doubts about their gender, find it tough to make decisions about some part of transition, like who they want to come out to or what changes they like to make to their body, if any. So it's very, very common to have doubts or fears about physical or social transition, especially if the client has people in their life who aren't very accepting. You do not want to imply in treatment that it's weird to have those fears or doubts. If anything, it's weird not to have any fears. So now we come to the fun part. How to use ERP to treat obsessions and compulsions related to gender in trans clients. So let's first take a brief look at the literature. Now, unfortunately, there really is not a lot of literature on gender themes in OCD, uh, either in cisgender or transgender people. And this is likely because it's really only recently that trans people have been the subject of more than a small amount of study altogether. I mean, try getting funding for research on gender identity in the 80s or 90s. I mean, try getting funding now. And really, it's only recently that trans people have actually been in the public eye on movies, TV. So really, if you're a cis person, it would be pretty hard to become obsessed with the idea that you could be trans if you didn't know what a trans person even was. Uh, so those factors probably influence why we're seeing these cases now. So anyway, there are only 3 journal articles that I'm aware of that looked at gender themes in OCD. Only 2 of them actually involved somebody with OCD, and none of them actually involved a trans person with OCD at all. So 2 of them are case studies from 2016 and 2017 of apparently cisgender men with troubling intrusive thoughts about whether they might be trans or actually want to be the other gender. They present very similarly to people with sexual orientation themes. Both articles described a lot of checking in about one's own feelings and thoughts, trying to prove that they weren't trans, get rid of the uncertainty, show themselves that they actually did want to be male. All of that familiar stuff that we know from sexual orientation, OCD themes, and other themes that involve like the unknown or these sort of internal processes. The second article, interestingly enough, was actually a case study of somebody assigned female at birth who came out to their parents, said that they were having gender dysphoria, and whose father actually believed that this was a symptom of OCD. So the therapist interviewed the client, administered the Y box, no indication of the presence of OCD. The clinician concluded that it was likely that the dad was just a lot more able to accept having a kid with OCD than having a trans kid. And here are the citations for those 3 articles in case the people watching the video later want to pause, take a screenshot, and look up any of those 3 articles. So outside of the literature, you're also going to find a lot of anonymous, like informal discussions of gender-related OCD themes in places like Reddit and other websites where people with OCD get together and discuss their symptoms and get support. So if you are looking for a first-person perspective of what it's like for either a cis person or a trans person to have these thoughts, that's a good place to look. But a lot of what I'm going to discuss here is based on my clinical observations treating trans people with OCD, which is one of the main focuses of my practice. Now, fortunately, I don't have to engage in a lot of conjecture or speculation here because this is actually well-trodden ground. There is really no evidence that trans people with gender-related OCD themes need to be treated any differently than people who are experiencing any other theme that involves one's own thoughts or feelings, like people who worry that they're not the sexual orientation they thought they were, or aren't attracted to their partner, or are attracted to kids, or people whose obsessions focus on preventing unknown future outcomes, like whether God will punish them or whether they're going to die in an earthquake. In other words, you're going to use the same ERP skills you use in treating OCD with any other theme. I know it sounds like I'm making a joke, but really you are not going to learn any new skills here. You're just going to be applying your existing skills in a slightly different way. So, one of the first questions you might be asking is, how do I know that this is actually a trans client and not a cis client who's having intrusive thoughts that they might be trans? And the answer to this question is that in general, in trans clients, you have a long-standing experience of gender incongruence that you just do not see in cis clients. In other words, a cis client will not have a history of identifying as another gender or having a sense of discomfort with the gendered parts of their body or their gender presentation, or wishing to change their gender when they were a kid or a teen, they're not going to state a straightforward desire to transition. Instead, they might say something like, "I'm afraid I might want to get rid of my penis," or "I wonder if I'd be happier if I took hormones." A cis client is not going to usually express a dislike for their gender characteristics or gender labels, although they might report intrusive thoughts about the possibility that they don't like those things. Usually in a cis client with gender-related obsessions, their distress is going to come not from their body or their gender presentation or the way that people label or see their gender, but from the fear that they might be trans or might not know they're trans, might not figure out that they're trans. In fact, much like clients with sexual orientation-related obsessions, these clients are not necessarily going to be transphobic or see transition as a bad thing or have a dim view of trans people. More often, they're going to be distressed about the idea that they may never figure out they're trans, or that they may be unhappy in the future or have to break up with their partner because they're trans. Another common fear is the fear that they're secretly unhappy now because they're actually trans and they don't know it, which is making them unhappy. They might scrutinize their feelings or test their reactions to certain thoughts. So for example, thoughts about like wearing different clothes or having a different body, being called by a different name. And again, I'm not aware of any cases of a cis person with OCD actually starting to openly identify as trans or transition. If they present at a gender clinic, they're much more likely to say, "I'm worried I might be trans," or "I think what I'm experiencing could be gender dysphoria." Now, in contrast, trans clients with OCD are a lot more likely to be worried about not really being trans. In fact, I've yet to encounter a trans client with OCD whose obsessions had not taken on that theme at one time or another, even if they're not experiencing it now. Fears in these clients generally relate to having to detransition, being a fraud, being outed as a fake trans person, or taking up resources that could be used for real trans people, quote unquote. In my experience, the core fear of social rejection or loss of relationships is very, very common. And for that reason, a lot of trans people with OCD will delay taking steps to affirm their gender, like using a new name or getting transition-related healthcare, because they're worried they're going to regret it or have to tell everybody, all their friends, that they're not actually trans. They might feel that they've got to be absolutely 100% certain before they move forward with gender affirmation in any way. So here are the general areas you and the client are going to need to focus on in treatment. We'll take them one by one in the next few slides. The client is going to need to learn to increase their tolerance of uncertainty and to decrease mental and physical compulsions in order to learn that uncertainty is relatively safe and tolerable. And as we've discussed before, when need be, you're going to need to help the client work on getting the support and resources they need to provide a stable jumping off point for treatment, provide psychoeducation about feelings of ambivalence about gender, which are very normal and common. One thing that I find a lot of therapists are uncomfortable with is the idea of the client moving forward with gender affirmation steps like coming out or getting medical treatment while still experiencing some uncertainty. And the thing I always emphasize is that you, the clinician, can be neutral about whether the feared outcome could actually come true. In the same way that you don't have to be 100% sure that a client obsessed with fire safety is never going to carelessly cause a house fire. You can't be sure, and the client can't be sure, that they'll never, ever come to a different understanding of their gender. All you and the client have to know is that obsessively overanalyzing or engaging in compulsions is just not going to help them better understand their gender or prevent them from making a mistake. And I do just want to emphasize here that detransition due to regret is very rare in trans people in general. In one survey, the rate was around 0.4%, and there's no evidence that it's any more common in people with OCD. In other words, these interventions are going to be effective whatever the client's identity ultimately turns out to be. Interventions designed to teach the client not to engage in compulsions or obsessive thinking are not going to put a cis person in danger of transitioning. That said, there really is no way to eliminate risk of regret, like I said, because there's no way to eliminate the risk of regretting anything you do. We know nothing in life is safe. Practically speaking, you can't cross the street safely or completely shield yourself against disease, because that's just not how life works. So you therefore need to help your client shift the focus away from attaining certainty about their gender and toward the goal of balancing risk with reward. And to that end, you'll want to talk about the drawbacks of inaction and decision paralysis and what the client is giving up by choosing not to act. Now, that's definitely not to say that you should push them to do things that they're not comfortable with or transition more quickly or with, steps that they don't actually want to take. Just that you should not let your own fears of being wrong about your client's gender hamper treatment. Another skill you're going to teach the client is that of differentiating the sensation of fear, the physical, the tightness in your chest, vigilance, from the actual rational perception of danger. And this is something many clients have a lot of insight about. Most clients will be able to at least somewhat differentiate between things they're actually afraid of and obsessional fears, especially when they're not currently in that fear state. There's typically going to be a tangible difference between the way they talk about rational and obsessional fears. Often they'll be able to say, for example, well, 10% of my hesitation about gender-affirming surgery is because I'm worried about complications, and I know that's probably logical because these things do happen, but 90% of my hesitation is about fear that I'm not actually trans and I'm not really and I'm going to actually have to have the surgery reversed someday. And I know that's probably not rational, but even the remote possibility still keeps me up at night. So let's talk about some common compulsions you're going to see in trans clients with OCD. Gender-related compulsions are usually predominantly mental ones. When somebody with gender-related obsessions gets an intrusive thought, they may do any number of mental compulsions to try and get rid of that thought or put it to rest. They may analyze their current or past thoughts or their actions to try to say, hey, is this something a non-binary person might have done or felt as a child? Do women usually have these mannerisms? Do men have these hobbies? They might compare themselves to other trans people, like, am I like this trans guy on Instagram? Is my experience the same or different from that guy's? They might obsessively think about how strong their dysphoria is, or whether dysphoria is actually what they're feeling, or whether they really, really want the changes that they're seeking. They might also think obsessively about how horrible it would be if they actually did have to detransition, or someone outed them as a fake, or plan what they do in that situation. They might test their reactions to thoughts or images like, does a real trans person feel dysphoria when they think about themselves wearing this thing or doing this thing? And as you can imagine, it can be really exhausting to feel like you've got to overanalyze every passing thought about gender that comes into your brain. So another very common mental compulsion is to push those thoughts out or to distract oneself, which really is not ideal because you want the client to be able to experience these intrusive thoughts as they come and go without overanalyzing them, but also without having to turn to TV or work or whatever for distraction or feel like they have to cleanse themselves of all trace of those thoughts in order to be happy. There are also some common physical compulsions, which include compulsively researching gender identity, watching videos or looking at websites about people who regret their transition, checking one's body in the mirror to evaluate whether one feels a certain way or has enough dysphoria to actually be trans. As I said before, a lot of trans people will delay transition steps, even if they're in a lot of distress and really do want to do those things. Avoidance is a big one. A lot of people, because they're having intrusive thoughts, they're going to avoid talking or thinking about gender, or watching shows with trans characters or shows that are about gender in some way because they're afraid of triggering these thoughts. Even if they want to talk about gender or they like watching these shows. And conversely, if a client feels safe with somebody and they trust them, they might constantly ask that person for reassurance that yes, their gender is really their gender. Generally, all of these compulsions are going to relate in some way to this sort of fantasy scenario of finally getting enough reassurance that they can finally attain certainty about their gender, or at least enough to be comfortable. Unfortunately, your gender is just one of those unknowable things, like the afterlife, or your sexual attractions, or your spouse's feelings toward you. The problem is constantly looking inward and outward for reassurance is counterproductive because it prevents the client from learning that it is actually okay to be a little uncertain, that is actually a totally normal thing. So the goal is going to be to help the client increase tolerance of moving forward without being 100% sure about their gender. And as I mentioned, this starts with you yourself accepting that gender is one of those squishy things that can't be analyzed with certainty. It's not like going to the doctor and getting a test for strep throat where there's this binary outcome. There's no questionnaire that can tell you with certainty whether somebody is trans, and you and the client just kind of both have to accept that there is some possibility of regret. Instead, your goal is to help the client learn through experience that just as they live with uncertainty about a lot of other things every day, about love and career and education and car accidents, they're totally capable of living with some amount of uncertainty about gender, which is no different from any other aspect of life. So let's talk about some strategies to help the client resist mental compulsion. It's very important to frame resisting a mental compulsion as an exposure and as a skill that the client can get better at with time. In other words, when an intrusive thought about, say, being a fake trans person appears, instead of engaging in a mental compulsion, the client needs to try to let themselves experience the fear that the thought might be true and to not to chase the rabbit down the rabbit hole and analyze the thought in order to comfort themselves. Now, I'm absolutely not saying that the client has to dwell on the idea that the intrusive thought might be true, or to concentrate their mind on just how awful it would be if it were true that they were faking being trans. I'm just talking about letting these intrusive thoughts come and go and not trying to dispel them or analyze them with a mental compulsion. That way, they build the skill of resisting chasing these thoughts to their conclusion. It'll definitely be uncomfortable for the client because, of course, it's uncomfortable not to have certainty about something bad. But it's worth it to practice because it makes it easier to live with those intrusive thoughts. The technique here can be a little bit difficult because the client might not actually see their mental compulsions as compulsions. For example, they may believe that thinking about detransitioning counts as an exposure because they feel bad while they're doing it. They may not understand that by doing the mental ritual, they're actually reinforcing the fear of not knowing whether they'll detransition. They may also think that intrusive thoughts are the same as mental compulsions just because they occur together. So you might have to work with that client to untangle whether what they're describing to you is an intrusive thought itself or the compulsive overanalysis that came after the intrusive thought. Additionally, they might feel like it's dangerous not to overthink their gender because, hey, what if the bad thing happened? What if they didn't guard against it and it came true? So in that vein, if a client actually does feel that their mental compulsions are necessary to avoid disaster, you might ask them a few questions to help develop their insight. You might ask, and this is a genuine question, how certain do you need to be? And the answer is, of course, going to be different for every client because everyone has different levels of risk tolerance, whether or not you have OCD. In general, most people have some idea of how much certainty is reasonable or possible in the same way that most people know how many times a reasonably careful person would look to cross the street, even if they themselves do a lot more looking because of an obsessive fear. You might also ask, is there a difference for you between your compulsive overanalysis and just regular thinking? Do you have more clarity after an hour of stewing about what your gender is? And for a lot of clients, these are two totally separate things, and they might actually have the insight to say, for example, I did some thinking yesterday about how I wanted my body to look, and it was genuinely useful and clarified some things to me. But that time last week when I was panicking for hours about whether I was going to have to go back to my old name and pronouns, that didn't give me any new insight. That was just pure anxiety. And here I want to give a brief shout out to Michael J. Greenberg. I've done some training with Dr. Greenberg in the past, and he's developed some techniques to resist mental compulsions that are really easy and intuitive to explain to clients. And a lot of my clients have found some success with these techniques. You can find them on his website, drmichaeljgreenberg.com. So let's move on to developing an exposure hierarchy for gender-related obsessions. Sometimes I'll get asked, what's a good exposure to try with clients with fears related to gender? And the answer to that question is that exposures are always going to be highly individualized and heavily dependent on the intrusive thoughts the client's been having and the compulsions they've been engaging in as a result. There is no exposure that works for all or even the majority of trans clients. They should also address both mental and physical compulsions, which may take place at the same time, and I'll go into a little bit more detail about that in a couple of slides. Now, as a general rule, the way I develop an exposure hierarchy is basically to ask the client what they want to do or need to do and let them write their own exposures. So I might ask questions like, what kinds of things would you do to affirm your gender if you weren't anxious? What would you do or not do if you were 100% sure of your gender and you didn't need to worry? What kinds of activities, people, images, media, etc. do you avoid out of anxiety about the authenticity of your gender? What do you do to reassure yourself that your gender is real, that you really don't feel like you need to do? At what times or during what activities do you feel the most fear or uncertainty about your gender or find yourself analyzing your gender? And these are all the kinds of situations where the client can either practice decreasing avoidance of activities that trigger intrusive thoughts because you've taught them the skill to handle those thoughts without getting lost in them, or they can practice making decisions that involve uncertainty or risk. Now, finally, I'm going to talk about some common pitfalls in designing and executing exposures. In general, I don't do imaginal exposures with gender stuff. The client actually does not need to habituate themselves to scenarios where they might actually be a fake trans person or actually have to detransition. That really does not help the client practice tolerating uncertainty, because in that scenario, they do have certainty about what their gender is. In that imaginary scenario, they've realized what their gender is, which might actually be comforting, even though it's not an optimal scenario. So instead of that, instead of imagining these scenarios, they need to practice the skill of not knowing, which requires giving up certainty and accepting some level of ignorance. And the way they get better at that is just to practice, to accept that they genuinely don't know and tolerate how that feels to them. Another thing you're going to have to watch out for is mental compulsions replacing the more visible, concrete, physical compulsions. So let's say maybe the client has successfully stopped Googling gender identity late at night, or compulsively checking the mirror to make sure if they still feel dysphoric. But instead, they're ramping up their mental compulsions like overanalysis, those compulsions that provide the same promise of reassurance that physical, concrete compulsions provide. So you're definitely going to want to make sure the client understands mental compulsions as reassurance seeking and not as this inevitable thing that their brain is just doing on its own. Similarly, mental rituals might make physical exposures less effective. So let me give you an example. Maybe you have a trans male client who's afraid that he might someday want to go back to living as a woman, and the exposure you've agreed on today is to watch a movie with a female main character, which he's been afraid to do because he might identify with that character, and that might bring up questions about his gender, even though he really wanted to watch that movie. So let's say he's sitting there watching the film like he agreed to do, but he's doing some other things in his head. He's also analyzing his reactions to the female main character and reassuring himself that he doesn't really want to be Scarlett Johansson or look like her, and all those mental rituals. And what he's doing there is making the exposure feel safer for himself, because he doesn't have to sit there with the uncertainty that there's this tiny, tiny chance that maybe he is a woman, or maybe he does want to detransition. So I definitely want to note that when you're doing these more concrete exposures, you are going to want to talk with the client about what they're going to do when these intrusive thoughts come up during these exposures, and make sure the client is ready to resist engaging in mental compulsions, going down that rabbit hole of overthinking, overanalysis, to make the exposure feel safer for them, to feel like they're doing something in order to make themselves safer. So that's the end of the pre-recorded portion of my presentation. I hope you got some helpful skills out of it. After the Q&A is over, you can feel free to email me with any additional questions. You can reach out to me with referrals. I train and consult on gender identity and sexuality, so if your staff needs training, I'm available as a resource. My website also has links to a ton of resources in the New York and New Jersey area for trans people, like where to find healthcare or housing or legal assistance. You can go to andrewtriska.com/trans-resources. Thank you everyone for your attention, and I'm very much looking forward to answering your questions in the Q&A.